Our top story this morning, up to 100 pop-up clinics will be created across the country and the government will subsidise video consultations as part of a $2.4 billion plan to stop the spread of coronavirus.
The emergency health package will include a $30 million information campaign to stem panic buying and comes ahead of an economic stimulus package that will be unveiled later on this week.
It's clear Australia isn't immune to the coronavirus crisis, but the government wants to make sure the health system is well prepared. To give the country a fighting chance, a multi-billion-dollar package will boost the ability to effectively assess, diagnose and treat those with COVID-19. The package, totalling $2.4 billion, includes establishing 100 pop-up respiratory clinics across the country. Aimed at supplementing the work of GPs, they'll see up to 75 patients a day who show symptoms of the virus. A new Medicare item will be created, allowing health services to be delivered over the phone or through video conference to those with coronavirus symptoms at their home. $30 million will go towards a national communications campaign to ensure factual and consistent information is provided. The government says the pop-up clinics will be located in areas of need to divert people away from emergency departments and GPs, all with the aim of limiting the spread of COVID-19. Starting Friday, the telehealth service will be bulk billed and available to those self-isolating, people over 70, Indigenous Australians over 50, those with chronic health conditions, parents with new babies or pregnant mothers. And as more footage like this emerges showing shoppers stampeding to toilet paper panic buy, the government hopes its marketing campaign will start to sink in, all aimed at protecting Australians from the coronavirus and each other. David Shiraz, Sky News, Canberra.
A Western Sydney school will remain closed today after 2 of its students tested positive for COVID-19.
The city's northwest is where a cluster of cases has appeared as the number of cases nationwide surpasses 100. Stella Todorovic is live in Sydney for us this morning. Stella, there are 6 new cases in New South Wales just in the last 24 hours.
Yes, Laura, and there are now 61 confirmed cases right here in New South Wales, and almost 30% of those are linked directly to hotspots in Sydney's northwest. I'll talk you through these latest 6 cases which were confirmed overnight. A woman in her 60s and a man in his 60s both arrived from the United States recently. It's important to note these cases are not related. A man in his 60s who recently arrived from Switzerland, a woman in her 60s arrived from Italy and has links to a previously diagnosed case, a woman in her 30s who is a relative of a deceased resident from Dorothy Henderson Lodge in Macquarie Park, where a nurse unknowingly cared for residents while infected, a woman in her 40s, and her case is still under investigation. Laura, in New South Wales, 3 schools, 3 hospitals and an aged care facility have all been the centre for an outbreak right here in Sydney. It's understood that 150 people have had contact with those 2 students from St Patrick's Marist College in Dundas, and that school will remain closed for a 3rd day as contact tracing continues in those cases. In Victoria, we've seen 3 new cases overnight, bringing the state's total to 18, and 3 new cases also for Queensland. And as panic increases across Australia, the federal government will now reconsider its travel advice to Italy, where more than 400 people have died from the illness. Laura.